Hi, I'm Sam Huntley. I'm the Research Implementation Officer at the Brain and Mind Centre. And today I wanted to talk to you about my experience with simulation modelling, as well as what the team will be implementing to support greater community engagement in your regions, with a particular focus on lived experience. So my experience is that I've been where you are right now. I first came into contact with systems modelling when I was a commissioning coordinator at the mental health team for my local PHN. That's me there. I'd never heard of systems modelling, and when I first engaged with the team, I was intrigued but dubious about how a computer model was going to understand the intricacies of the region that I was working for. I had no experience with data science, and at the beginning, it felt like learning a completely new language. But I could tell by the way that the team talked and guided not only myself, but the people in our region through the data and the most up-to-date evidence in the sector, that this program was going to lead us towards a more evidence-informed and community-empowered commissioning process. The 3 workshops were quite transformational for the people that were selected to participate. It brought together different agencies responsible for implementing policies and programs in our region, as well as a strong lived experience presence. This workshop process got us all on the same page and guided us to see the bigger picture. One of the quite empowering things that I found for myself was beginning as someone completely new to this field and worried that I might somehow break the model, to someone by the end of the process feeling confident and supported by the team to update the user interface and produce reports, deliver presentations based on the outputs of the model that I had run and tested to support community understanding of the model outcomes. As the team has mentioned before me, this modelling process has been built upon both local and international research, but that doesn't mean that the needs and the ways of communicating and interacting in your region can't be incorporated. Some of the concerns that were raised by the people in my community was whether this process was going to support their voice and knowledge of the people and structures within the region in any meaningful way. The region had just emerged from participating in a project where they had felt that their voice wasn't able to be heard and that a program had been placed upon them. It was incredibly important at this point in time to not only take the community and sector leaders through this process, but to also engage with the wider region. So in addition to the stakeholders who were part of the workshop process, we engaged additional community leaders to engage with the wider community and complete the following: educate a wide variety of geographically and demographically diverse stakeholders about the modelling process that was occurring in the region, and then support those stakeholders to have input into the local service pathways to be modelled and identify interventions of interest to be included in the modelling process. This led to wider engagement across the region. It also made a noticeable difference to future funding submissions that came through from service providers and community groups who would use the information from the model to support their tender application, showing their maturity and growth in aligning local contexts with national and international evidence. We know that genuine stakeholder engagement in mental health system design is critical to ensure that reform is successful within these complex environments. Through the use of participatory action research principles described before me, the research team intends to engage early with each and every local community to ensure that adequate time to form genuine, user-led participatory systems modelling processes occurs. As Grace has described, this will ensure that the diverse voices of the community are heard and supported in this process. An advocacy plan for this research program has been co-designed with those with a lived experience to bring to life the program objectives of awareness, engagement, and integration. From social media platforms, Twitter and Instagram, program awareness videos, and video diaries, there are an incredibly broad options for supporting engagement of your communities with this program. More novel will be the use of the Inform podcast hosted by Samuel Hockey, who represents the Lived Experience Working Group and is one of our lived experience researchers at the Brain and Mind Centre. This will be available to create awareness of the program in the lead up to the start of workshops and also to capture the process that each site undertakes as part of the program, highlighting challenges faced in each community by those informed individuals and how our research and its outcomes and implementations have impacted them. The Informed podcast will aim to highlight the challenges faced across Australian communities and how our research partnerships, such as those with CSTART, the Computer Simulation and Advanced Research Technologies, and the Centre for Best Practice in Aboriginal and Torres Strait Islander Suicide Prevention, can implement challenges that tailor problem-solving techniques to culturally and geographically diverse communities in mental health provision. Thank you.